Today we're going to be talking a little bit about engorgement. And engorgement is something that mothers have when their milk comes in about 3 to 5 days after they deliver their baby. This is when their breasts get fuller, heavier, warmer. Most women have some sort of breast tenderness by about day 5. If a mom does have a C-section, then she might have engorgement just a little bit later than a mom who had a vaginal delivery. But basically what's happening with engorgement is that the mom's breast milk production is rapidly increasing. In the beginning, the body really doesn't know how much to produce, and so it produces a lot. After that, the baby is what regulates mom's milk supply. So the more the baby feeds, the more milk the mom produces. If the baby cuts back, the mom's milk supply will cut back, and the two match. So the baby is the one that determines it after that. There are some things that the extreme breast fullness though with engorgement rarely lasts for more than 24 hours, so it's a short time period. There are some things that can make engorgement worse. One is if the mom is giving formula supplements, because this means that the breasts are not being emptying as regularly as they would if the mom was exclusively breastfeeding. If the mom is not feeding frequently enough, or if she's time limiting her feeding, so she's not going long enough, engorgement. Also moms that have had any kind of breast implants or breast surgery, they're also at a higher risk for engorgement. So these moms would just need to make sure they checked with their doctor prenatally and had a conversation so that they know a little bit better what to expect after the baby arrives. The problem with engorgement is that it can affect mom's milk supply if the pressure in the breast isn't relieved. And what's happening is the milk cells in the breast are getting bigger. They're filling with milk, and so they're kind of crunching together more. And that leaves less room for blood to circulate in between them. And it's the blood that's bringing the hormones like oxytocin to the breast, which causes that milk ejection reflex and gets the milk moving. So with less blood and less oxytocin, that milk is sitting there, and it makes it harder to get it out. The other thing that can happen is as pressure builds from the inside, it can make the nipple and the areola tissue hard. And so if the nipple is flatter, it's a little bit harder for the baby to latch onto the breast. So there are many things that moms can do to stay comfortable during this short time period of engorgement. The number one thing is to nurse frequently. Moms need to make sure after delivery that they're nursing correctly, early, and often. If the mom starts to feel uncomfortable, she can latch her baby to the breast and the baby can relieve them in that 24-hour period. Another thing that some moms find helps is to use a little bit of breast massage, because that can cause just a little bit of leaking. So just rubbing the fingers down the breast towards the nipple and just doing some breast massage, that can also help relieve engorgement. One of the things that moms can try to soften the area around the nipple and the areola if it is getting hard, to make it easier for the baby to latch on, is called reverse pressure softening. And what the mom can do there is, what she's trying to do is just about 1 inch to 2 inches around the nipple. She's trying to soften that tissue. And what moms can do is use 2 fingers, any combination of fingers, it doesn't outside of the breast. What this is doing is pushing that fluid upwards and backwards into the breast and away from the nipple area. So just pressing gently, holding that for about 60 seconds. It shouldn't hurt, so very gentle pressure. Then when she removes her fingers, there'll actually be 2 dimples where her fingers were. And so then she can just overlap those dimples slightly and hold here for 60 seconds, move around, and so eventually moving around the whole breast. And that is, again, just moving that fluid back. The fluid will return, and so it's good for her to do this technique right before she latches the baby on. And some moms find that if they lay flat on the ground, then gravity helps as well pull that fluid away from the nipple and make it a little bit easier for the baby to latch on. Another thing that sometimes helps during engorgement is to use moist heat just prior to feeding. Just getting a wash rag wet or a rag and just with warm water and putting that over the breast. That again will cause a little bit of leaking more than likely and relieve a little bit of that pressure for mom. Some moms also find that a cold compress in between feedings can be helpful with a little bit of swelling at the breast. That coldness feels good. One thing that some moms use are cabbage leaves, which you may have heard about, and they've looked into cabbage leaves, and there's nothing scientific, or they don't have any properties as far as helping with engorgement. I think cabbage leaves are just the right size, the right shape, They can come from the refrigerator or room temperature. Just wash them, put them inside the bra, and that can provide a little bit of relief as well. For some moms, the babies just aren't going to be hungry enough and willing to latch on and feed enough to relieve that pressure. And if the heat isn't working, massage isn't working, some moms might need to use a pump to relieve that pressure. Some moms might be told not to use a pump because the pump will stimulate milk supply, and you would think that would make it worse, but the opposite is actually true. The congestion and relieve the engorgement. Moms might find that using a pump on a lower vacuum and a little bit faster speed, it might be more comfortable if she is having some pressure in the breast. So just remembering that unrelieved engorgement can cause problems with milk supply. If that pressure is building up and mom's not releasing the pressure, that can decrease milk supply, and it will eventually lead to poor growth and development in the baby. The other thing to remember too, if it's unrelieved, that flatness, or if the pressure builds up from the inside and it's hard and flat, the decreased elasticity of the nipple actually makes it more prone to damage. So oftentimes if moms have unrelieved engorgement, they might also have problems with sore nipples. So if moms are trying these things and it's just not getting any better, if the engorgement is not improving, then they need to either call their WIC office, they can call the hospital where they delivered and speak with a lactation consultant, or connect with a lactation consultant somewhere that can help do an assessment and give them more personal ideas that they can try to relieve that engorgement. So thanks for tuning in today. We hope you'll join us again next week, same time, same place, Tuesday at 10 o'clock. Thanks.